Please tell us your name.
Yeah, I'm Larry.
So what led you to purchase the 28-day knee program?
Well, I was about to think about getting knee placement. I had already had cortisone shots, gel shots, injections, and I thought, well, I'm going to try to get in best shape possible for a knee replacement. But then I came across Dr. Middaugh and his videos on YouTube, and just by doing some of the exercises, the free exercises basically, I think he had one video there about the best 3 exercises for your knees, and I started doing those. You know, starting out with the tailgate swing and a few others, and I would say almost immediately I started feeling some relief. So after about 2 or 3 days of the free videos and exercises, I decided to purchase the program, and I'm on my 7th week right now, and of doing the regular exercises, understanding how my glutes are very important, understanding a lot more than I did before of what's important in strengthening my knees and not getting knee replacements.
That's awesome. So what's the one thing that you're doing now that you couldn't do before starting out these exercises?
Oh, basically just going up and down stairs. We have an incline at home on the driveway, and it was very difficult to do that. So I have more flexibility. I have greater strength, and just a greater understanding of what it takes to have healthy knees.
What's your favorite part about doing the program?
But I'm getting better, and I'm not going to have a knee replacement.
That's definitely a great thing. So what would you say to somebody who's considering buying the 28-day knee health and wellness boost program, but is just not sure about it?
Listen, just from my experience, this is the, what's that expression? The best thing since sliced bread. This is an opportunity to improve my health, improve the health of my body and my knees, and I've proven it for myself. So continuing with this program and getting help from Dr. Middaugh and the rest of the staff to just continue improving.
Fantastic. Well, thank you so much. I appreciate your time.
Oh, you bet. Thank you.